Hello friends, today I am going to reveal some true facts about diabetes mellitus. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Now, what is diabetes? Diabetes mellitus DM is a group of disease characterized by high level of blood glucose resulting from defects in insulin production, insulin action or both. The term diabetes mellitus describes a metabolic disorder of multiple etiology characterized by chronic hyperglycemia with disturbances of carbohydrate, fat and protein metabolism resulting from defects in insulin secretion, insulin action or both. The effect of diabetes mellitus include long-term damage, dysfunction and failure of various organs. Diabetes mellitus may present with characteristic symptoms such as thirst, polyuria, blurring of vision and weight loss. In its most severe forms, ketoacidosis or a non-ketotic hyperosmolar state may develop and lead to stupor, coma and in absence of effective treatment, death. Often symptoms are not severe or may be absent and consequently hyperglycemia sufficient to cause pathological and functional changes may be present for a long time before the diagnosis is made. Diabetes long-term effects. The long-term effects of diabetes mellitus include progressive development of the asphyxic complications of retinopathy with potential blindness, nephropathy that may lead to renal failure and or neuropathy with risk of foot ulcers, amputation, Charcot joints and features of autonomic dysfunction including sexual dysfunction. People with diabetes are at increased risk of cardiovascular, peripheral vascular and cerebrovascular disease. Burden of diabetes. The development of diabetes is projected to reach pandemic proportion over the next 10 to 20 years. Types of diabetes. Diabetes mellitus and type 2 is also diabetes mellitus. Gestational diabetes. Other types, LADA, LADA, MODI, maturity onset diabetes of youth, secondary diabetes mellitus. Type 1 diabetes was previously called insulin dependent diabetes mellitus, IDDM or juvenile onset diabetes. Type 1 diabetes develops when the body's immune system destroys pancreatic beta cells, the only cell in the body that makes the hormone insulin that regulates blood glucose. These forms of diabetes usually strikes children and young adults, although disease onset can occur at any stage. Type 1 diabetes may account for 5% to 10% of all diagnosed cases of diabetes. Risk factors for type 1 diabetes may include autoimmune, genetic and environmental factors. Type 2 diabetes was previously called non-insulin dependent diabetes mellitus, NIDDM or adult onset diabetes. Type 2 diabetes may account for about 90% to 95% of all diagnosed cases of diabetes. It usually begins as insulin resistance, a disorder in which the cells do not use insulin properly. As the need for insulin rises, the pancreas gradually loses its ability to produce insulin. Type 2 diabetes is associated with older age, obesity, family history of diabetes, history of gestational diabetes, impaired glucose metabolism, physical inactivity and race, ethnicity. African Americans, Hispanic, Latino Americans, American Indians and some Asian Americans and native Hawaiians or other Pacific Islanders are at a particular high risk for type 2 diabetes. Type 2 diabetes is increasingly being diagnosed in children and adolescents. Gestational diabetes. A form of glucose intolerance that is diagnosed in some women during pregnancy. Gestational diabetes occurs more frequently among African Americans, Hispanic, Latino Americans and American Indians. It is also more common among obese women with a family history of diabetes. During pregnancy, gestational diabetes requires a treatment of normalized maternal blood glucose levels to avoid complications in the infant. After pregnancy, 5% to 10% of women with gestational diabetes are found to have type 2 diabetes. Women who have had gestational diabetes have a 20% to 50% chance of developing diabetes in the next 5 to 10 years. Other types of diabetes mellitus. Other specific types of diabetes results from specific genetic conditions such as maturity onset diabetes of youth, surgery, drugs, malnutrition, infections and other illnesses. Such type of diabetes may account for 1% to 5% of all diagnosed cases of diabetes. LADA, LADA, latent autoimmune diabetes in adults, that is called LADA. Latent autoimmune diabetes in adults is a form of autoimmune type 1 diabetes which is diagnosed on in individuals who are older than the usual age of onset of type 1 diabetes. Alternate terms that have been used for LADA includes late onset autoimmune diabetes of adulthood, slow onset type 1 diabetes and sometimes also type 1.5. Often patients with LADA are mistakenly thought to have type 2 diabetes based on their age at the time of diagnosis. Patients usually aged more than 25 years in LADA. Clinical presentation masquerading as non-obese type 2 diabetes. Initial control achieved with diet alone or diet and oral hypoglycemic agents. Insulin dependency occurs within months but can take 10 years or more. Other features of type 1 diabetes: low fasting and fast glucose stimulated C peptide, HLA susceptibility alleles, ICA plus and GADA plus. About 80% of adults apparently with recently diagnosed type 2 diabetes but with GAD autoantibodies, that is LADA, progress to insulin requirement within 6 years. The potential value of identifying this group at high risk of progression to insulin dependent includes the avoidance of using metformin treatment, the early introduction of insulin therapy. MODY, 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 maturity onset diabetes of the young. MODY is a monogenic form of diabetes with an autosomal dominant mode of inheritance. Mutations in any one of the several transcription factors or in the enzyme glucokinase leads to insufficient insulin release from pancreatic B cells causing MODY. Different subtypes of MODY are identified based on the mutated gene. Originally, diagnosis of MODY was based on presence of non-ketotic hypoglycemia adolescents or young adults in conjunction with the family history of diabetes. However, genetic testing has shown that MODY can occur at any age and that the family history of diabetes is not always obvious. Features suggestive of monogenic diabetes. MODY, MODY, majority have HNF1 alpha and HNF4 alpha mutations. Young onset of diabetes generally less than 25 years of age. A strong family history of diabetes, typically 2 to 3 generations affected. Sulfonylurea sensitivity, absence of insulin resistant, phenotype normal BP, TG, HDL-C. PNDM 50% have 6 mutations. Diabetes onset less than 6 months of age, Dent syndrome. Within MODY, the different subtypes can essentially be divided into 2 distinct groups: glucokinase MODY and transcription factor MODY. Distinguished by characteristic phenotypic features and patterns on oral glucose tolerance testing. Glucokinase MODY require no treatment, while transcription factor MODY, that is hepatocyte nuclear factor 1 alpha, requires low dose sulfonylurea therapy and PNDM caused by KIR 6.2 mutation requires high dose sulfonylurea therapy. secondary diabetes mellitus. Secondary causes of diabetes mellitus include acromegaly, Cushing syndrome, thyrotoxicosis, phenocomycetoma, and chronic pancreatitis and cancer. Pre-diabetes, impaired glucose tolerance and impaired fasting glucose. Pre-diabetes is a term used to distinguish between people who are at increased risk of developing diabetes. People with pre-diabetics have impaired fasting glucose, IFG, or impaired glucose tolerance, IGT. Some people may have both IFG and IGT. Both. IFG is a condition in which the fasting blood sugar level is elevated 100 to 125 milligram per deciliter or milligram per deciliter. After an overnight fast, but it is not high enough to be classified as diabetes. Impaired progression to diabetes among those with pre-diabetes is not inevitable. Studies suggest that weight loss and increased physical activity among people with pre-diabetes prevent or delay diabetes and may return blood glucose level to normal. People with pre-diabetes are already at increased risk of other adverse health outcomes such as heart disease and stroke. Research studies have found that lifestyle changes can prevent or delay the onset of type 2 diabetes among high-risk adults. Prevention or delay of diabetes, the lifestyle modifications. These studies include people with IGT and other high-risk characteristics for developing diabetes. Lifestyle interventions includes diet and moderate intensity physical activity such as walking for 2.5 hours each day or each week. In the diabetes prevention program, a large prevention study of people at high risk for diabetes, the development of diabetes were reduced to 58% over 3 years. Studies have shown that medications have been successful in preventing diabetes in some population groups. In the diabetes prevention program, people treated with the drug metamorphine reduced the risk of developing diabetes by 31% over 3 years. Diet is a basic part of management in every case. Treatment cannot be effective unless adequate attention is given to ensuring appropriate nutrition. Diet treatment should be aimed at ensuring weight control, providing nutritional requirements, allowing good glycemic control with the blood glucose levels as close to normal as possible, correcting any associated blood lipid abnormalities. Dietary fat should provide 25% to 35% of total intake of calories, but saturated fat intake should not exceed 10% of total energy. Cholesterol consumption should be restricted and limited to 300 mg or less daily. Protein intake can range between 10 to 15% total energy, that is 0.8 to 1 gram per kg of desirable body weight. Requirements decrease for children and during pregnancy. Protein should be derived from both animal and vegetable sources. Carbohydrates provide 50 to 60% of total calorie content of the diet. Carbohydrates should be complex and high in fiber. Excessive salt intake is to be avoided. Please important, this is important. Excessive salt intake is to be avoided. It should be particularly restricted in people with hypertension and those with nephropathy. Exercise, important. Physical activity promotes weight reduction and improves insulin sensitivity, thus lowering blood glucose levels. Together with dietary treatment, a program of regular physical activity and exercise should be considered for each group, for each person. Such a program must be tailored to the individual's health status and fitness. People should, however, be educated about the potential risk of hyperglycemia and how to avoid it. In my next video, I will give you the details treatment of the diabetes mellitus. Thanks.